Let's talk about the epidemiology of syphilis. Syphilis is a global disease. It is a global disease with significant variations in prevalence and incidence across regions and populations. The disease is endemic in many low and middle income countries with slight resurgences, periodic resurgences in high income countries. Syphilis is disproportionately higher in certain age groups, particularly in men having sexual intercourse with men, people with multiple or concurrent sexual partners, also in people with or people living with HIV/AIDS. Millions of new cases are reported globally, with increased prevalence in sub-Saharan Africa as well as in parts of Asia. Congenital syphilis is a critical public health problem, particularly in regions with limited access to antenatal care as well as routine screening. Increased urbanization, population mobility, and inconsistent public health intervention leads or has contributed greatly to ongoing transmission and recent epidemiological trend of the syphilis infection. Let's talk about risk factors of syphilis. Certain factors make an individual prone or susceptible to acquiring syphilis. Some of these factors include engaging in unprotected sexual intercourse, also men that have sexual intercourse with other men. Being a sexual worker is also a predisposing factor. Co-infection with other sexually transmitted infections, particularly HIV, also predisposes. Poverty, reduced availability of healthcare facilities, low educational status, and limited sexual health education. Also, low or limited access to antenatal care predisposes to particularly congenital syphilis. But these and other factors predispose an individual to acquiring syphilis. Let's talk about diagnosis. The diagnosis of syphilis relies immensely on clinical evaluation, on serological testing, as well as direct detection. Direct detection methods, including dark field microscopy and direct fluorescent antibody testing, is able to demonstrate the presence of treponema pallidum in lesions, in exudates that are obtained from active lesions. These direct methods of detecting or of diagnosing syphilis is most useful in primary and secondary syphilis, and it requires specialized equipment as well as expertise. Serological testing is the cornerstone of syphilis diagnosis, and serological testing is divided into two. It's divided into two. We have the we have the non-treponemal tests. We have the non-treponemal and the treponemal test. Serological testing is divided into two: the non-treponemal test and the treponemal test. Under the non-treponemal test, we have the VDRL. We have the VDRL. We also have the RPR. The VDRL is the Venereal Disease Research Laboratory. The RPR is the Rapid Plasma Reagin Test. This test detects antibodies against the cardiolipin lecithin cholesterol antigen. Cholesterol antigen. The non-treponemal tests, which include the VDRL and the RPR, they detect antibodies against the cardiolipin lecithin cholesterol antigens. The non-treponemal tests are basically screening tests, and they are performed to assess the disease activity. They are non-specific and they may exhibit a false positive result. We also have the treponemal test. The treponemal test, under which we have the TPHA and also have the FTAA. That is the treponemal pallidum hemagglutination assay and the fluorescence treponemal antibody absorption test. These tests are basically done to detect antibodies specific to the treponemal pallidum antigen. They are confirmatory tests and they are performed in order to confirm the presence of infection. Neurosyphilis is diagnosed by carrying out a cerebrospinal fluid analysis, including serological tests, cell count, as well as protein analysis. Culture is another new contemporary mechanism or diagnostic method of diagnosing syphilis. Formerly, due to the fastidious nature and the limited metabolism of the treponema pallidum, it could not be cultured in artificial laboratory medium. But currently, due to advancement in medical diagnostics, treponema pallidum can now be cultured in the laboratory. It is usually cultured with rabbit epithelial cells in specialized low oxygen medium, particularly the TPCM2. The TPCM2, which is the treponema pallidum culture media 2, is the culture media that is used to isolate treponema pallidum. Let's talk about prevention and control. Prevention and control of syphilis is based on engaging or discouraging unprotected sex, proper and consistent use of condoms, discouraging multiple or concurrent sexual partners, increased public health intervention campaigns and surveillance, increase in sexual health education, also increase and adequate access to antenatal care, screening in high-risk areas are all preventive and control measures against syphilis. Let's talk about treatment. Syphilis is treatable, and penicillin is the antibiotic of choice against syphilis, particularly the benzathine penicillin G. The benzathine penicillin G is the recommended antibiotic in treating syphilis. But if penicillin allergy is discovered by the clinician, alternative antibiotic used is usually tetracycline as well as doxycycline. Penicillin is the antibiotic of choice, but when penicillin allergy is noticed by the clinician, tetracycline and or doxycycline are the antibiotics that are alternatively used in cases of syphilis.